Hey, you're a good boy. My name is Barbara Anderson. My problems started about 5 years ago with my hip. I was on track to have my hip surgery, my right hip surgery at Medical City Frisco, when unfortunately I had an accident at home injuring my back.
There was already a plan in place to treat her for the hip arthritis, but her back became a more significant issue, and so we opted to treat the back first. Ms. Anderson presented with difficulty standing and walking for significant periods of time. This was largely due to lumbar stenosis, which is basically tightness in the spinal canal. We looked at doing a lumbar laminectomy, which involves taking the back of the spinal canal off through a minimally invasive approach to take pressure off of the nerve roots.
It's very common for patients to have both lumbar, spine, and hip issues. They're somewhat interrelated, so we see a lot of that in our clinic. This is an x-ray of Barbara Anderson's pelvis. Here on the right side, you can see severe arthritis. The joint space is lost. So she had a total hip replacement, and she came back a few months later and had her left hip replaced.
Today I am pain-free for the first time in years. I'm able to do the things that I love to do. I was able to take a trip of a lifetime going to Hawaii in February. I was able to walk 5 miles a day. I'm able to do all of my own gardening. I have no pain whatsoever. I'm able to walk my dog on a daily basis. My future holds that I'm going to continue to stay healthy and pain-free, and Medical City Frisco made that happen for me.